welcome back to Behind the Masks. I'm EJ, one of your co-hosts, and with me today are Lori and T. This is episode 33, The Masks of Pain. And just a friendly reminder that anything discussed in this podcast is not to be used as a diagnosis or a replacement for conversations with your own doctors, therapists, psychologists, or other medical professionals. As I said in the intro, we're talking about pain today, and we're not talking about like the pain of something happening. We're actually talking about physical pain that we go through with our different ailments, whether it be acute pain, like breaking a bone and having to heal, or going through the pain of chronic pain that comes from arthritis and other ailments that we'll talk about in this episode. All of us in some way, shape, or form has dealt with both acute and chronic pain personally, as well as observing the other people in pain and seeing what pain does for those people, either just in general, the pain and how it makes them act, but also how different pain medications can cause people to act different ways. And what's the stigma around taking pain medication versus possibly an alternative options, which there are a lot out there. I know I've personally dealt with a lot, having watched my dad go through a lot of chronic pain with his back and legs and just different things. So that's kind of what we're going to talk about, and we'll hopefully give you some statistics as well. We wanted to start out by talking just about the side effects of pain, just in general. If pain of any kind, whether it's acute or chronic, and acute being something that just happens and will eventually go away and never bother you again per se, whereas chronic is something that continually goes, it doesn't stop, it doesn't end. You're going to have it basically for the rest of your life. It can cause irritability. It can cause, lack of sleep, because sometimes the pain hurts when you lay on that side or lay on your back, or you have to change your sleeping patterns. You may have to sleep in a chair versus sleeping in a bed. And irritability comes with, being snappy at people, getting aggravated easier or quicker. It can cause emotional stress. It can cause mental and spiritual stress, because sometimes it limits you for doing things. You can't always go out. You can't do the walking that you would desire. Maybe you can't go to an event because it's going to require more walking, or it's going to cause you more pain than you need to. And those are just a few of the side effects that I've observed as being, a daughter of someone who was in chronic pain and watching him suffer. Like literally, because of his diabetes, my dad had neuropathy, which caused like a tingling and a numbness in certain joints and limbs, to where he sometimes couldn't feel where he was walking because his feet had no feeling. And so he was on pain medication for it. And his, the infections that he would get would cause pain, and he'd had surgery. So he dealt with different pain from just healing from a surgery. And pancreatitis is extremely painful when your pancreas becomes inflamed and it's doing the work of two organs, and it can't, it needs a break. So those are some brief experiences that I've had. Lori, Tina, do you guys want to share anything? I'm sure you have plenty to say.
I think for me, as we were getting ready for this episode, one of the things that kind of shocked me, I'm going to share some other experiences later and stuff that I've been going through lately, but I was kind of shocked by the statistics from the CDC that 1 in 5 Americans suffer from chronic pain. I just felt like that's a huge number.
It's huge.
And then T, you were mentioning that, that might even be increasing. And why do you think that is?
Well, I'm curious to know if the statistics have changed over time and what they used to be, because it seems to me that more and more people are describing chronic pain. And I've also noticed other diagnoses increasing, and I'm not sure if it's just anecdotal or if it's actually a trend. And for example, in my family, we have sudden diagnoses of diabetes, which has not been a thing in our family. We've had one person way down the line that we know of that had diabetes. And then within my own clients and whatnot, I've noticed like more and more coming in, like I just got diagnosed with diabetes. And some of these people are midlife, like 30s, 40s. Um, and so, and there's other illnesses I've noticed arise in, and like I said, it's hard to say whether it's anecdotal. I'd like to know if, see if there's any trends and increases, including chronic pain. And I suspect it's, and I've never been this person, but I suspect it's a lot to do with the foods we eat now compared to what we ate 100 years ago. And so it's just
Well,
just
and what
something
about
that I've noticed.
environmental effects
Hmm.
and different medications, advancements within medical technology? I mean, we've talked about that with the fact, I know way back in the beginning, we talked about chronic illness etiquette, and we
Yeah.
talked about the fact that they're the fastest growing medical need in the world is chronic illness,
Right.
because we're able to diagnose sooner. We have more, all these advancements, and then we have a longevity of life. And so that we
Right.
didn't have 100 years ago. So you're
Well,
right. I mean, I think besides food, there's the environment, there's medical advancements, there's just so many factors that we could put in there that I'm sure you're right. It's probably pretty monumental. I'd love to see the statistics. That would be interesting. I might have to go do that just for fun.
right. Well, and you brought it up, longevity of life. 50 years ago, the average person was living until their mid 60s, if that. And so, unfortunately, chronic pain does often hit when you do get into the higher ages, 50s, 60s, 70s, because of things you're diagnosed with. And so, a lot of the older people struggle with some sort of chronic pain, relating to something that they maybe worked as when they were younger that didn't really impact them until later in life.
Right.
Well, I'm seeing people younger and younger. I mean, I look
Yeah.
back, and I've had chronic pain my entire most of my life of some sort, but I didn't acknowledge it as that. I just kind of kept going. But I'm seeing like I mean, I'm ballparking it, but like at least 8 out of 10 clients come in with diagnoses of fibromyalgia.
Yeah.
And that's another one that I just, 20 years ago was barely diagnosed. Now, that being said, doesn't mean it didn't exist. It's just they didn't,
Right.
because I didn't know a lot about it.
Yeah.
But it seems to me that the amount of people with chronic illness or chronic pain is, the numbers are bigger now. Is it because our tolerance is lower than it was 100 years ago, and people just,
Probably.
they had to do what they had to do, and they just had a different mindset about pain? Because I know one of my observations and sometimes complaints is that it seems to me that we're so quick to go and um, we're so quick to go and uh, get a pill to fix something, and rather than have a tolerance for it. So, I mean, again, that's more observational, not based on any facts. It's just something I've just kind of noticed. And it makes me think about the fact that pain exists for a reason, just the same as I talk to my clients about like feeling sad, feeling mad. Those are feelings that happen to let us know that something's up. Well, same with pain. Yeah, our pain is to let us know something is wrong. Like if we're touch something hot, to pull our hand away. Um, if we have a chronic pain, and maybe like I get chronic pain in my feet, um, that tells me that something's wrong with my feet, and I should check it out. And my brain recognizes it so that I can favor it and not hurt it more.
Right.
So, I don't know the source. It just seems to me that there seems to be an increase
Yeah.
in reports of chronic pain.
Yeah.
Yeah.
Well, and pain can be debilitating.
Yes.
It's I'll let Lori talk about more recently what's been going on with her and why she missed last podcast. But you know, just when I was younger, we lived on kind of an incline. Our house was not on a flat level. And so running up and down the yard to light fireworks off one 4th of July, I stepped in a gopher hole and wrenched my ankle really bad. And to this day, I still have problems with it. And they call it a chronic sprain, which means it was sprained, it never healed properly, and I could step on it wrong one day and the next day it's swollen and hurts because it's just a chronic sprain and it
Right.
causes me pain. And so I
But
have to live with that.
that pain reminds you to take care of that ankle because it didn't heal right.
Exactly. So it reminds me that I have to make sure that I have the right type of shoes. It reminds me that I have to be, a lot of people are like, well, why do you look down when you walk? I'm like, because I don't want to step on a rock or step in a hole. And you're like, well, why don't you like walking across grass? Well, because there's holes in grass. Like, I'm sorry, but I don't know where the gophers are. And I'm not going to hunt down and step in a hole or a divot and be like, oh, well, there goes my ankle for 4 days. And then I've also gone through, I've had my gallbladder removed, and I'm grateful that my gallbladder surgery was super smooth. It was in and out. I was at the hospital at 10 a.m. My surgery was at noon. I was done at 12:45 and I was already home and on the couch at 3 o'clock. Like, it was that quick. And I took one prescribed pain medication that night. Extremely constipated, went, nope, not doing this. Drank some prune juice the next day and I did Tylenol for it the rest. But I have a tolerance for pain. A little twinge and a little ache doesn't bother me. Yes, it tells me something's up and I should probably maybe check on that. But I knew what the pain was from and I just kind of, I guess you could say, white knuckled it and just said, nope, I'm just going to take Tylenol ibuprofen, which my doctor said I could do if I didn't want to take the pain medication. And some people can do that. Others can't. And, some people look at me like, you did what? How did you, how could you, weren't you in pain? I'm like, I was in pain. I just let it happen. Cause, and that's, if that happens for a surgery and you're recovering and it gets better, it's one thing. But when the chronic pain starts and it never goes away, that's when it can become more debilitating, because then it's affecting your day-to-day life. It's affecting your reactions to things. It's affecting the things you do and don't do or choose to do or wish. And then you start having the spiraling of, well, I'm in pain, so I can't walk. Well, if I can't walk, then I can't go do this. So I can't spend time with these people. So then I can't go do this. And then, but if I don't do this, then I can't do this. And so it's just the spiraling of, and then depression can start in, and anxiety and agoraphobia.
A quick side note, one of the common symptoms of depression is pain.
Yep.
So we experience it what we call somatically, which means we experience it within our body. Children especially report more pain, more headaches, more stomach aches, etc., when they're depressed or dealing with trauma and even anxiety. You will see an increase in stomach and headaches.
Right.
So,
wow.
So Lori, why don't you share a little bit about the pain? Not so much the medication yet, because we want to go into that in a little bit. But
we'll get there in a minute. Well, the reason I look like I'm in my PJs is because I'm home recovering. I just had major surgery. It's interesting, I've been dealing with pain in my knees for many, many, many years. I used, topical things. I've used Tylenol. Unfortunately, not unfortunately, but I recently, a little over a year ago, had bariatric surgery, which has limited my body with my chronic liver disease. It's limited my ability to do some of the more traditional things that you do for pain. So I've had to be really creative. But I would say the thing I wanted to kind of talk about, correct me if I'm wrong, ladies, I kind of typically have a reputation for having the patience of a saint. I'm normally pretty calm, cool, collect. Even when my emotions start to get out of check, usually I'm able to rein them back in and then kind of move forward. Not this time. Oh my goodness gracious. I've watched some videos because I've been dealing with, chronic illness issues for a while. I'm not going to lie. Previously, probably before this surgery, I would have entertained some judgmental thoughts of how I thought people handled their pain or their stress or whatever. That's just me confessing, and saying I'm human. Um, I've also been told I have a very high threshold for pain. When my orthopedic surgeon was looking at my x-rays way back before I ever even lost the weight and did all this stuff, he's like, Lori, my colleagues and I are wondering how in the world you're walking around. Because I have osteophytes, I have on the bones, I had bone grinding on bone for years now. And so that level of pain, about the pain scale 1 to 10, 1 being the best, and or 0 being best and 10 being the worst, I pretty much started my day at a 4 or 5 all the time.
Right.
So I had built up a certain amount of tolerance for pain.
Right.
I had no idea what I was getting into when I had this surgery. I have since learned that bone pain is some of the worst pain ever. I can now totally attest to that. I've had several surgeries in my life. This is in the top 3. So I just had a left total knee replacement surgery. So I have metal and robotics in my knee. I feel like I'm becoming the bionic woman because I'm supposed to have that done in my right knee too. We'll get back to that later because I don't even know if I want to have my right knee done right now. This has been so crazy. But what I wanted to talk about is that judgmental piece that I definitely would have had before this surgery. And my compassion and my empathy for those in pain. Oh, I so get you people now. I so get it. Oh my gosh. Aaron and my youngest son, who's currently staying with me right now, can attest to the fact that I've not been myself. Waves of nausea came with some of the pain in the beginning. It was so out of control. I spent probably the first couple of weeks just trying to get a handle on the pain. I didn't even feel like I could come up for air. Like people were like asking me things and I'm like, what did you say? I don't even, I felt like everyone was speaking in a Charlie Brown, the parents in the background, want, 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 want. That's how
Mhm.
I felt. Like people would ask me questions or talk to me and I'd be like, huh, what?
Yeah.
I was so totally unfocused. All I could think about was pain at these astronomical levels. Now, again, for me, an astronomical level, I'm going to say it's an 8. I just was like 9. I don't think I ever quite got to a 10,
Mhm.
but close, really close. And so I now have a new appreciation for what people do and say and act like when they're in pain that I didn't have before.
Well, and
And
I
I've
like
had to, oh, no, I just want to say this real quick. I've had to ask for grace and mercy and forgiveness about a million times since having this surgery to EJ and to my roommate, to my son, to my family, to my close friends. I've just had to say, please forgive me. This is not me. This is pain,
right.
And
Yeah.
so, yeah, I had to do that
Well,
about a million times already.
yeah, and since recording this, it's been about 6 weeks now since you've had your surgery. In fact, today we're going to your, I think, 6 week checkup.
Yay.
And you know, observing the pain, and it's funny I hate the pain scale that they have because they equate 10 to being natural childbirth. Well, I'm sorry. No man has ever felt what childbirth is. I've never felt it, and I'm a woman. So how can I compare childbirth pains to the pain I'm feeling because of my X, Y, and Z going on? So like Lori has had children, so she understands, like, so she gets that. But like the pain scale, I don't truly believe, because it's relative for every person.
Yes.
You know, Lori may say a 6 is like excruciating pain, and to me a 6 is like, well, I live with that every day. You know, and so everybody that has pain of some kind, for me, a twinge in my finger doesn't really bother me compared to the pain that I have in my ankles, or, you know. And it was probably maybe 15 years after I hurt my right ankle, I did the same thing to my left ankle, just a different way, still same result. Now I have 2 chronic ankle sprains, so I have to remind myself that. And, you know, watching Lori, and just, she was in tears some days, like, this hurts. And and I think this is kind of a good time to transition into like talking about pain medication.
Yuck.
Yeah.
Before we start that, EJ, if you don't mind,
Oh,
I think you bring up something really good. But before that, I want to acknowledge that Lori had one of the top painful surgeries. Like, every doctor, every medical professional will tell you that a knee surgery, I can't remember if it's the top painful one or if it's in the top 3.
Knee
I
and
know shoulder
shoulder.
surgery is another one. And it's because it's weight bearing. It's because it's one of our most movable joints, etc. But I also want to make a nod at something you indicated, EJ, is that pain can be relative and subjective. It depends on the person. And I get really frustrated sometimes because, like, I'll get people like, oh, my pain's not as much as this person's, or taking the 10 as childbirth, because childbirth is different for everybody.
exactly.
And our brain and our bodies as women are designed to not recall that pain.
Yeah.
We can remember it was painful, but we can't bring it back up and imagine what that was like again. Otherwise, we would never have another child.
Right.
So, and then that's because there's these different hormones that are released during childbirth. And, like, I love to talk about oxytocin, keeps us from eating our young. But, and again, that pain is subjective and relative. And I would say that some people with chronic pain get used to a certain level of pain because our brains are like, look, we're going to have to figure out how to deal with this because it's not going away. So we're going to kind of get numb to it in a way, or distance from it in a way. And that works for some different types of chronic pain. It's not that that individual's not in pain. They've just learned to kind of like, oh yeah, that's kind of like oops, knocking stuff around, but that's sort of like, oh yeah, that shoe fits tightly. Okay.
Right.
you know,
Yep. No, you're
Yeah,
right.
exactly.
so it's really hard and to compare one person's pain to another. And so yeah, so if someone says they're in a lot of pain, they're in a lot of pain.
Don't you think that comparison, T, and one of the things I've been learning a lot in, my counseling sessions after bariatric surgery is looking at things with less judgment. A comparison is it's a tool of judgment, don't you?
Yeah.
And so with judgment comes a whole lot of other things that really aren't necessary.
Right. Well, and here's the thing too, is like, I was just thinking about how I had a hysterectomy. It was like EJ describing with her gallbladder. I had my gallbladder removed. That was worse than the hysterectomy. But mine was done as an emergency, the gallbladder. The hysterectomy wasn't. And I couldn't tolerate the pain meds. And so I just was dealing with it. And it didn't seem that bad to me. I was just like, okay, yeah, it hurt. I'm not going to deny that it hurt. So I had some friends who are like, yeah, I'm going to have to get a hysterectomy. I'm like, oh, that's so easy. Oops. Because I got a call back like, you lied. This is not easy. This hurts so bad. I'm like, okay, I am never telling anybody that again.
Right. I know.
And I think, and that's what Lori experienced, because she was not truly prepared for what this was going to entail. and even I, like, I'm grateful that I'm living with her right now, because had I not been living with her, when she came home, she probably would have died the first few days, because she wouldn't have been able to take care of herself. Like, she would have
Yeah.
been stuck in one position for like 4 days. I mean, I know that her kids would have stepped up, and, friends would have, come in and helped. But like, I was up like every 3 hours during the night to help her go to the bathroom, because she just couldn't walk to the bathroom. Like, just
Mhm.
little, what do we
Do you
call it in the
remember, do you remember
field of
me
like,
crying in the bathroom? I literally broke down. I
yeah,
I can't
I
even
think I
remember the
do.
last
Yeah.
time I broke down. I think it was the first night.
You're like, I just
I
can't do
was
this.
so afraid. I remember crying and saying, "Aaron, I can't do this. I can't get up. I can't." I was so afraid. I was like,
Well,
"Oh my God, I'm stuck here. I'm never leaving the
well, and
bath."
I think it was and I don't think it was necessarily a fear of that. I think it was more of a, since we had a lack of preparation and like preparedness from the doctor of like actually what this was going to entail and how bad you were going to be. Because again, everybody's relative. Some people breeze through knee replacement surgery like it's no big deal, and it's like just a walk in the park, literally.
I
Other
wish.
people, they struggle. And we were the doctors were treating you just like any other patient. And we had to keep reminding us and you're not any other patient. You
Right.
have
I didn't go
limitations.
into this surgery healthy like some other people do. I've
Right.
already got the diabetes, the chronic liver disease,
Exactly.
all these other factors, all the limitations with the
So we
meds.
didn't
And
have the bathroom set up appropriately for you.
that's
Had we
right.
known that you were going to need a commode to like handles in the toilet, we would have arranged for that prior to surgery. So that was all ready when you came home. But we didn't know because we were unprepared. Like, they did not prepare us for what
No, no.
truly went on.
And
I
that
did
that
feel the most
panic,
unprepared.
and fear that you were feeling, Lori, um, that's also a result that people sometimes forget, is that our brains don't like the idea of someone being in our body.
Yeah.
So surgery is it doesn't just affect the body part that they're doing, it affects the brain, because the brain totally rejects it. It's like, this is not okay. When we have a wound, it sends things to that wound to help heal it and all this other stuff. And so your brain gets overwhelmed and goes into like a shock mode. And
It's interesting. Kevin said, Mom, it was almost like you had a knee transplant.
Mhm.
He was
mhm,
like, I think this is almost like a transplant. And he goes, sometimes our bodies reject that, remember? And I was like, oh my gosh, that's insightful.
right.
And you brought that up. And because they literally cut out a section of my bones
hmm
and that whole kneecap, took it out, right?
Yeah,
Your,
I just
your
watched the
knees like
video and
open
it was
like
done.
this, and then they implant all of those pieces and that
hmm
whole new knee, and then close you all back up and
Yeah,
send you home.
your brain goes into shock.
It was kind of
And
traumatic, yeah.
Yeah.
and then when you're in that flooding pain, your brain doesn't know how to escape it. And that's all
Right.
you wanted to do, was escape that pain, because that's what we're built to do. We're to get away from the pain. We're to stop the pain
Yes,
somehow.
yes,
And
yes.
so that
I
all of
just
that is a
wanted it to
factor
stop.
that we often forget.
Right.
Yeah. All right. So let's go ahead and move into the pain management, if you will.
Right.
Because this
So
is now, as I say this, we've all agreed that we're not going to talk about some specifics within certain things, kind of like we've done before. We don't want to talk about hot topics and buttons and political issues. And yeah, we just want to talk about what just the plain basic issues of pain management. So
right. And so
having said that,
traditionally, when you have surgery, when you have chronic pain, your doctor will prescribe you pain medication. Sometimes you can manage to take a strong, a higher strength ibuprofen, or stronger Tylenol. Other times you have to be put on, narcotic pain medications, opioids, which has definitely become, unfortunately, like an
mm,
epidemic here in
a
the United
nasty
States and in
stigma.
many other countries too, because your body has this way with pain medication. And I watched my dad, he was on fentanyl patches, and I remember Like we'd put a fentanyl patch on him, which is supposed to last 3 days. We put the patch on, like the first 24 hours, he would sleep for like 24 hours. And so this last 72 hours, so the first 24 hours, he'd be sound asleep. He'd have about 12 hours of cognition, like totally with it. Then he'd get tired, fall back asleep. The next day, when it's time to change it again, he would be totally like in pain and needing it, because the patch is designed to, the medication's basically on the patch, and it subcutaneously goes into your system over time. Well, unfortunately, that first day you're getting a lot of it, so your body just basically sleeps because that's all you can do. And then it kind of wears off over the next couple of days, and then it's time to change the patch, which that did not become very efficient for his pain management. So they put him on pills that he could manage. Well, when your body gets the relief, then it likes the relief. So then it wants to take more to get the relief. And so he was on quite a bit of strong pain medication, along with Cymbalta, which is an antidepressant that they found in trials could also help with neuropathy, which is pain, or like the neuropathy, nerve pain. And he was on gabapentin, which is another one that helps with phantom pains and others. And all these narcotics, as well as these things, can be given concurrently. And just in that alone, you may not know what end is up. Because some days you may have a clear head, other days you may not, and every person is different. And it's not always just well, you're 200 pounds, so you get this amount, or you're this. It's like your liver can only handle so much, and your kidneys can only handle so much. So there's limits on what you can have in a month period. Like medical companies have a cap on a lot of this stuff, which I think is the unfortunate reason why many people have to turn to alternatives. And I know, like myself, like I said, when I had my surgery for my gallbladder, I took one Percocet. The next day, it was Tylenol from then on out. Tylenol and ibuprofen, just the bare minimum, and that's got me through. For my ankles, I take an ibuprofen in the morning and I take one at night, and I'm good. I'm a little achy in the day, but it works. When Lori had her surgery, she was on. And unfortunately, the doctor wrote the prescription in a way that technically he only gave her 30 pills, which if she followed the directions to a T, she would have only had 5 days worth of meds. I'm like, what? What are you doing? Like the math doesn't even work right there. Like, but unfortunately for, Lori, because of her liver issue, she can't take ibuprofen. Also because of her stomach. Because of the bariatric surgery, she's limited on the pain medication she can take. And the knee replacement surgery causes inflammation.
Swelling at the knee.
So an ibuprofen is an anti-inflammatory. So she can't take that, which means she's been using a lot of ice and a lot of other ways of like mindfulness and breathing and stuff to try and separate the pain, because it's just been overwhelming.
So, thanks for leading me into that. Yes, I had a lot of limitations this time around, and I think that really affected, my levels of pain, where I was at, how totally unprepared for this I was. And having heard all those stories of healthy people going through it, and I mean, you ladies know the first 3 weeks, people are like, well, why aren't you farther along? Or didn't you just have, and I'm like, please stop talking, everybody. I can't even think past the pain. Just stop talking, everybody. Apparently I'm not you, and I suck at this. I had so many doubts and so many fears and so many unexpected expectations of myself and those that I felt others had for me. And, I really wasn't prepared. I really do not like, for me personally, I did not like the side effects of opioids. I felt that I was very out of control of my emotions and my thoughts. I felt that I was driven, kind of, you mentioned this EJ, I was on a time, because the nurses were like, don't get behind the 8 ball, stay ahead of the pain. So every 3 hours, I've got an alarm going off telling me 3, 4 hours to take another pill, and I felt like I was living for that darn alarm to go off. Okay, it's time for another pill, take another pill. I'd have a little bit of relief. I would be able to get a tiny bit of intermittent sleep. And then it started all over again. And I was back in pain. And where's the next pill? And this sucks. Life sucks right now. And I was highly irritable. And okay, I know we've already, opened up that can of worms. My grandmothers are rolling in the grave. I'm talking about being in the bathroom, but I got horribly constipated. We had to go get x-rays. I had to have all the stuff. I'm not even mentioning all the unmentionables that I had to go through after this, but I had to go to the hospital. I had to have all these things done because my body wasn't working. The opioids were messing it up even more. Yeah. And so, then
and this was from surgery day to like the day that she actually was treated was almost 2 weeks, because one, I couldn't get her to go.
No, I didn't want to go back to the hospital.
I don't need to go. We'll just do this. And unfortunately, that is one of the major side effects of narcotic pain medication is constipation. Yeah. And, so for 2 weeks, or the time frame this was, she had all of the medicines and stuff that her doctor had given her in surgery. It's because there were times where she'd just like fall asleep and just like be out of it. Like, what's going on? But she had the anesthesia still in her system. She had all the pain medication she'd been given. She had all the pain medication she'd been taking still in her system because her body couldn't get that toxic out of her system.
As I was backed up. So, yeah.
And
so
I finally like, nope, we're going. I don't care what you say, we're going.
Yes. So, I can take that off my bucket list now. I've experienced those lovely things that I never want to go back to experiencing again. But
and I also brought up something I think last week to you. And I was like, you're going through grief too with this pain. You had the surgery and you were doing really well prior to it. You were active, you were getting lots of steps in during the day. And now you're in this process where now it's been a month and a half. And you're grieving the loss of that.
I am. I want to be dancing and walking and hiking and doing all this stuff. And I'm sitting in a chair or on a bed.
And so you're grieving and you're going through those processes of right now losing it. And the desire, goal, and plan is for you to, get back to that. But again, with the lack of preparedness on your part and the doctor's part, because I'm totally blaming the doctor for this. We just didn't expect it to be this long. Everyone's like, oh, it'll be a couple of weeks, it'll be good. Right. Oh, we'll have you walking the minute you're,
we
out of surgery.
Planning vacations. We were planning trips and all this stuff, and we're having to put all that on hold because we just didn't realize that really it's about a minimum of 12 weeks. Right. Before, and so I'm only halfway through that first 12 weeks of.
And I know right now we're talking a lot about like acute, because this is acute pain for Lori. This is stuff that will go away, will get better. So she's just kind of in the midst of that gunk right now. But this can also go for chronic pain. When you start having chronic pain consistently and it's not going away, that there's a grieving process, because then they're losing. And you're grieving the loss of the lack of pain, and you're losing the ability to function the way you did before. And that you go through the grief process. Grief doesn't just come because somebody passes away in your life and you're upset about it and you go through the grieving process. The grieving process can happen. And I know we talked about this in our chronic illness podcast, that, it can happen at any time. It can happen at the loss of an ability, the loss of a sense. So that's what was happening, is she was going through this time where she's grieving right now, the what she's not able to do.
Yes. I think I said to you, I feel like I'm in a gilded cage.
Yeah. Again.
I just want to be out of this gilded cage. I'm very grateful for the roof over my head and the place that I'm in, and really that I'm not in a third world country dying of dysentery, so I'm thrilled that I'm at the same time, I am grieving the loss of activity, the loss of independence, the loss of, and that feeling of being out of control, which is, T, you wanted to say something because I want to go into the next pain management thing. You wanted
No,
to say something.
I think I was just thinking about the fact you mentioned gilded cage, and that's been an issue before.
It has. I don't do well with my gilded cage. I don't like being a bird in a cage. I really don't. I just want to go and soar and fly and do my thing like any other normal
Well,
person, I guess. But yeah, or whatever. Yeah.
and
I
then
like to fly.
you talking about, because there's a reliance that you had to have on other people that you're not used to having. You and that's coming from the pain. You're relying on me or your son to take you to the doctor. You're relying on us to move and adjust your walker. You've told me so many times, I don't want to be a burden. I'm sorry I'm a burden. And I'm like, you're not a burden. And again, and every time I say that, I make it very clear, I'm not mad at you. I'm mad at the doctor.
So, and here's the thing is that she, in all fairness, Lori's had to rely on people for a while for a lot of things like going to the doctor. However, she hasn't had to rely on these very personal things to have help, even such a thing as adjusting the walker. That's that. So it's every, for the first 6 weeks, it's been most every minute of every hour of every day, needing to know that just to adjust in the beginning, I'm sure just to adjust on your seat, you probably needed help.
I couldn't
So,
even do that. Yeah. Oh.
so yeah, it builds up. And if you're able to kind of pull back, you probably realize you have a little bit more freedom and independence now than you did 6 weeks ago.
Yeah.
Totally.
But it's not enough yet.
No,
But you're
I
on,
want more.
yeah, but that's what you're heading towards. But it's hard to remember that. It's hard
It
to
is.
remember that. And I really like the fact, EJ, that you're talking about grieving, because that is absolutely true. That anytime we go through a change, we grieve, but what's difficult is those with chronic pain or chronic illnesses. That implies that there's not going to be a turnaround. There's not going to be a healing process where you get to go back and have that back again. And oftentimes it's sudden. For example, my husband with this cancer diagnosis, and it's one that will never go into remission. So the way things are not going to get better and will likely get worse over time. So you have this sudden change, like everything I thought was going to happen in this part of my life is not going to happen. And then there's a lot of talk of the old days. I used to be dependable. I used to be able to make plans and do them. I used to be able to show up at a friend's house and help them move and know that I could do it. I could stick it out and make it to the end. As a matter of fact, way beyond everybody else, but now I can't. And so there's this change in identity that can happen. And I think when there's pain involved, it's just that pain sometimes is just a reminder of that, not just, but it's a reminder of that on top of experiencing the pain.
Yes. So having said some of those things, we brought up the fact that I chose to make some changes. I did not like the opioids. I'm not going to go into any details about what I chose. What I will do, though, what I want to be very clear with is I didn't take those decisions lightly. We did research. EJ, my son, nurse friend of mine, another, we did research. Remember, and I know we've said this in other podcasts, please just don't go to your typical .coms, go to your .orgs, your .govs, your, hospitals.
Net. Mm-hmm.
Wikipedia
right?
is not a resource.
Yeah, Wikipedia,
just in case you didn't know.
Med.com that's going to tell you you're dead by tomorrow, no. Okay. So we did a lot of research and had to make a tough decision because of my very sensitive system. I had to do a session of white knuckling, if you will, suffering through. I had to get the opioids out of my system before I could add in the alternative, or I could really mess up my body, the rest of it. And so,
because the alternative and the opioids can interact poorly and
yeah,
also cause issues. So we
yeah.
didn't want that to happen.
So we didn't want that to happen. So I white knuckled it. I did find out later from my PT and my counselor that probably should have done it a little bit differently, because I went through some massive withdrawals that I didn't know about. I have never had to take a lot of opioids and different things, and so I didn't know about withdrawals. That 12 hours of my life, I don't even know how much of it I remember. I remember it was horrible. I remember I was not a nice person. I remember I was in massive pain, like waves of nausea pain, but I got through it. And then we started with the alternatives, and we went very slow. We did what's called micro dosing. We did small things. I had EJ and my son by my side the whole time, observing me, kind of like EJ said with her dad. My body was so exhausted. I think I slept for almost 72 hours, like 3 days. I was so exhausted. My body didn't even know how exhausted it was, because I'd just
Right.
been in constant pain
Well,
for,
and
almost 3
thankfully
weeks.
for you, you're not insulin dependent, so it's not as freaky to let you sleep. We would because we could barely get you awake to eat something.
I know.
And then on the opioids, she was extremely nauseous. She couldn't keep foods down. She really nothing sounded appealing because it was taking her appetite away.
I have lost so much weight because I've had no appetite. And if I wasn't sleeping or having waves of nausea,
Right. And
yeah.
I think I know there's acupuncture is an alternative pain relief thing. I don't know if but unfortunately not all medical covers it. And so I know Lori's limited on what she can do. And that is again also why she chose to do the research on what she could and couldn't do, because she's limited on funds and couldn't just walk into an acupuncturist clinic and get the same treatment because of her medical.
Massage is also one, but
Mhm.
here's what I can tell everybody. And I will make sure to give EJ a couple of the links I got sent from my counselor. One of the most amazing and free things that I have engaged in to get a handle on this pain is mindfulness, guided meditation, and things that I'd never heard of called binary beats, and just amazing things that I listen to. I can hold on to my phone. I can click on one of those links he sent me, and I'm going through a guided meditation and a
Mhm.
walk it was amazing. So amazing that last night was my very first night with no medication. Woohoo!
Ah,
It was so amazing. I was telling EJ this morning when I got up, guess what? I didn't take any pain meds last night. It was awesome. It felt so amazing to not be driven and guided by the pain. Um, and I did have a couple of bouts last night where I had some pain, and I clicked on those links. I went through this one meditation that I'm walking on a beach and, I'm doing this stuff, and I'm like, okay, I'm in my happy place. Now, I'm not saying it takes it all away. These are not magic pills. They're not
It's called pain management.
pain management. Yes. And I was amazed. Well, our brains, as you know, Miss T, are these amazing things. And if we can concentrate and be mindful in different ways. So I was curious. I wanted to look this up before, and we'll probably have to go back to this, okay? Because we watch in movies all the time. We watch stuff, Okay, the most amazing show you have to go out and watch, everybody, is called Limitless with Chris Hemsworth, the guy that's
Mhm.
Thor. I'm not good with actors' names. Please forgive me. Anyway, he does this whole thing, and it's all about the mind and the body and all these connections and everything, and how he's trying to improve his health and improve his longevity and, be there for his future grandkids and all this stuff. Anyway, it's really amazing. But T, maybe if where there is some, or if there's some region. What's this idea of mind over matter? Can you talk to that a little bit? Is that just pie in the sky, or is
No,
that real?
no, we do it all the time.
Right.
We do it all the time. Anytime, like if you're a lot of times we do it without even thinking about it. So like when right now I'm really hungry and my stomach's growling and my instinct is to go eat, right? But I can't right now because I'm doing this. That's mind over matter. This is a simplified version.
Okay.
Mindfulness is a type of mind over matter. And so I'm really glad you brought those things up, because those things do work. Now, you have to go in willing to try it. You have to go in willing to know that it's not what you're used to. And so you may kind of react to that and deal with that. And then anybody who's got trauma history, meditation and mindfulness are often difficult. So kudos to you for being able to do that and use it. So I'm pretty impressed.
Remember, I shared with you one of those conversations with my counselor about empowering myself as I chose to make these decisions. I think that was really key and important, that it's my choice.
Yes.
And that I have empowered choices.
So that's
really
what
helped me.
I work really hard with clients on, that is giving them every bit of choice and calling it out. Like, look what you chose to do. This is a choice you made, because so many people who experience trauma feel powerless.
Yes.
Their choices were taken from them, and it's accurate. I mean, their choices were taken from them, but there are things we can choose to do in response to that. And sometimes that can empower us to do what we need to do. But the research is definitely out there, and I want to make a nod to something. I don't know for sure if this is an area that we're going to avoid, but is that my concern with you having a 12-week recovery and being on pain pills the entire time is the likelihood of addiction, the addictive properties of opioids,
which I didn't want to deal with either. Yeah.
Right. That's huge. I mean, you had to deal with withdrawals. And imagine if you'd have done it for the full 12 weeks. Now, they probably would have been trying to taper you off. That's where people get caught up. So many people is when you have a long-term recovery and you need pain med assistance. Yeah. So I think, in my personal opinion, when you're going to go into a big surgery like this, I think there should be counseling ahead of time on pain management. What are you going to do over the long term? How are we going to keep you from being addicted? We can do the first few of this. We're going to titrate you down, but let's get you practicing mindfulness. Let's get you practicing meditation and some alternative pain management.
I wouldn't have known about any of those things without my counselor.
Right.
Like, I just didn't know they were there.
Right. And so, and even doing the research, you weren't running across it. And that's one of the things that even you and I had talked about is that there's different ways to manage pain. Right. But you didn't have time to prep for it. And thankfully you had that relationship established with your counselor that you were able to get into that. But I think so many people go into these surgeries or dealing with chronic illness and there's no prep work. There's no, it's like you go in for your blood draws ahead of time. Right. But you don't go in and make sure you're ready for the pain, because if they had prepared you.
Right. If they had prepared me.
Yeah. If they had prepared you for the level of pain you were going to have, could have, not guaranteed to have, could have.
Yeah. Yes.
You may have been able to just naturally go into like doing mindfulness, meditation, this binary thing you're talking about. I'm a little curious about that because the words you're saying tells me that it's likely bilateral in some way,
Yeah,
which
it's
is a
this
form of
thing with the beats.
EMDR.
Yeah, it's similar to that, but it's this musical thing. They're called binary beats. We'll put the link in the thing and I'll send it to you
That'd be
later.
awesome.
It was
Um,
amazing. But
But the other thing too
yeah, no, go ahead.
is something called the tapping solution. It's designed for people to be able to do without a counselor present, and whatnot. And there are free videos on YouTube, done by the people who have books and a whole program out about it. But one of theirs, I think one of the free ones is for pain. The other one's for anxiety that I've seen. So
Okay.
those are things to look into. It's called the tapping solution. So
Okay, so let's make sure to put a link in there too for that, EJ. You had brought up something, a term I hadn't heard before, but you were blaming my surgeon and his staff for not preparing me, and you're right, I wasn't appropriately prepared. You used a term I hadn't heard before, treat them and street them, or street. Yeah,
oh
I was
yeah.
like, wow, because
Well, yeah, I was gonna,
so fast, and it was yeah.
Unfortunately, in the way the medical system, and I won't go into it all, but unfortunately, and from observations I've had over the last like 10 years of taking care of my parents and other people, doctors want to help, but because of the medical system and the limitations and all the laws and legalities they have that they have to follow, or their license is in jeopardy, they literally like, okay, you need a knee replacement. Okay, let's treat it and get you out of there. Like literally treat them and street them. Like get them out, like treat you, get you out. Like that's their goal.
And that's kind of how I felt.
And part of what they'll promote at that point is you'll heal better at home.
Yes, which is true. You'll be more comfortable in your own home, but that takes the liability off of them because they don't want the responsibility.
Yeah.
And I know that I observed it a lot with my dad. It's just like, okay, okay. But like T and I had talked about in the episode, we pushed back a little, and I pushed back, and I was like, no, he's not coming home. He's not ready to come home. He needs some PT. He needs people like to take care of that. And he needs to get better. So when he comes home, he can like function in his home. And like Lori, she had her surgery on a Tuesday. She was discharged the next day. Like, I'm like, what? Like, you had a knee replacement. You had bone taken out. You had, like, I just literally just watched the video of what a knee replacement entailed.
It's disgusting.
They're sawing the ends of her femur and her fibula off to fit this artificial piece in and then gluing in with bone glue. I'm sorry. Bone pain is the most excruciating pain you can have. And my dad went through it the first time from his amputation, the first one they did, because they did them in separate times, with no nerve block. So he spent 12 hours in the post-op crying like a baby because he was in so much pain from the amputation. And I told the second surgeon, because it was a different surgeon the next time that did the amputation, he goes, oh my God. He's like, I don't even want to hear that. He's like, they didn't do a nerve block, because the second time the doctor did have him do a nerve block. And I was like, yeah, no nerve block. Just here you go. And like, even my dad said, it literally is. But again, you know how you say, like, you tap somebody on the shoulder and you don't feel it. You're just tapping them on the shoulder. You don't know. They could have had surgery on that shoulder and they could be twinging in pain because you did it. And that's what I mean by the doctor has no idea how much pain you're in because they're not feeling it. And I can't tell you how many times I've heard people say, man, I'll never treat my patients this way again after having a shoulder surgery or whatever, because they finally realize just how much pain it can be. And they're like, wow, and it's like these doctors are just like coming into their own and they're really saying, oh, wow, it really does hurt. And like, this does really hurt. And I'm like, yeah, hello. And and unfortunately, I know doctors are limited on what they can prescribe and how many they can prescribe per day or per month. And some of them want to, and others, like I had a client once and they'd had a surgery and they said it was a orthopedic surgery. And they said, we don't prescribe narcotic pain medications after 30 days. So I'm
Wow.
thinking, if Lori had continued on the opioids, he probably would have stopped prescribing after 30 days. So by now she would have probably been said, well, there you go, take Tylenol by then. So thankfully there's alternatives out there. It's not for everybody. And I wish things had been more legal when my dad was in pain, because I think he might have been a little better on that, the alternatives. But it wasn't legal back then. And, you know, and maybe with his other thing, but what I was talking about, like, I remember with you, Lori, it was one day you took some of the meds, like the alternatives. You slept the most soundly I'd seen you sleep the entire time since surgery. Like, you were asleep. Like, I was in the living room, I was up and down from chairs, I was cooking in the kitchen, I was doing all, and you were just out. Like, there was nothing waking you up. And I'm like, she needs this sleep. I think your son came back from work one day and it was like, shh, just don't, like, just, if you're going to go do something, just go in the other room. Because I just didn't want him to wake you up. And, you know, reluctantly, I had to wake you up later so you could eat something, because it had been most of the day. But again, like I said, because you're not an insulin dependent diabetic, I didn't have to worry about your blood sugars dropping so low that you like going to go into a diabetic coma because you
Right.
like no sugar in your system.
Thank God.
So, you know, that's something we have to keep an eye on. And my dad was not an insulin dependent diabetic either, but, you know, he was still a diabetic. So those are things you have to kind of weigh and look at.
So the great thing is that sleep, it sounded like a restful sleep. And
What?
that kind of sleep is a healing sleep.
Yes.
So that's time that your body, your entire body, including your brain, gets a chance to heal from just from the daily living. It flushes toxins, it gets real busy on that stuff. And it has a chance to send the things needed to heal your knee, and just all those things. It's just super good for you when you're recovering from anything, is getting restful sleep, not
And
just
that-
sleeping,
Yeah.
but restful sleep.
That's what's been so amazing about some of these guided meditations and the binary beats and stuff. I will say this, I was not a believer in any of it before. I really wasn't.
Right.
But I have received some of the best sleep that I've ever had, ever, by
I think
using those forms of meditation. They've really helped me to relax, to let go, to go into a restorative place that I don't think I've found before that. So,
I think we're onto something here. Honestly, I think that having that pre-op, being part of your pre-op, would be very, very beneficial.
yeah,
I think they'd see a higher level of full recoveries without a lot of complications. Going
yeah,
into a surgery, being able to do that, I think would make their jobs a lot easier.
I
I
agree.
think the actual operation would be affected by that. So, and you know, a few years ago, I'd have been like, "Psh, whatever."
Right? Me too.
leave that frou-frou stuff at home. Don't talk to me about that. And so they'll probably get some of that from their patients, that pushback. But if they could have, you know, like, I think a program would be great where they'd have people who've done it successfully be able to talk about the process of what it was like, that they weren't really into it either, but since doing it, what it was, the difference.
Yep.
Like, if you do
Major
get your knee
difference.
surgery, your other knee surgery, and I'm going to use the word if, because I want to honor your choice, but
I probably
if you
will. I just have to wait a little. I need a little more medical
know,
amnesia.
you know more going into this one, and you would have that that tool available to you, that doing some of those meditation practices and stuff like that, that you're going to be even more relaxed going into this one, the next one. Your
That's true.
brain's going to be in a different place because you can do meditation right up to,
A
and
little
just
less
kind
shock
of,
and awe.
yeah, let your brain be prepared
Right.
to accommodate it and not be so shocked.
Right.
Yeah.
Which it
So
wasn't this time. That's good. Yeah,
And
wise words.
you mentioned that about restorative sleep. I know for me, when I wake up from a night and I've had dreams, I know I feel better. Like I'm feeling better because I got into that REM sleep, that deep sleep where your body is relaxed to have dreams. I don't have dreams a lot because I'm restless or I'm tired or I'm this or I'm that.
right.
But when I do wake up and I've had dreams, I know, okay, that day seems to be better because I feel more refreshed than
Mhm.
if I'm just waking up from just my typical, like, get your 6-8 hours in and
Yeah.
I would say the other thing I want to mention, just because we are all faithful here and we don't hide it, I definitely wouldn't have as successfully gotten through all my previous surgeries and this one without my faith, without prayer, without knowing that I wasn't alone. I have several sisters in the church and brothers and family and who sent me encouraging scriptures and would text me or call me and be like, just checking in, Lori, how are you doing today? No judgment, just I want to be there for you. I want to encourage you. I know you're struggling. So the faithful component is another piece you just can't, and my favorite go-to scripture is Isaiah 40 verse 8. The grass withers and the flowers fade. And then I'm going to add, there's pain, there's hurt, there's grief, there's loss, there's all these other things. But guess what? They all fade away. And what remains is God and the word and our faith. And so tapping into that is hugely helpful. And so if you don't have faith, I'm sorry, but for those of us that do, don't forget to tap into that. Don't get pulled away from your foundation while you're going through all this. So
I also think it's really important to understand that doing things like meditation and mindfulness is not anti-God.
thank
It's
you.
not at all. Because that in the beginning, that was part of my resistance to the idea of it too. It, among other things, was that, well, it's an Eastern tradition, and is it anti-God? Is it against God to do these things? No, because I believe, and I can't quote it, so I'm just going to put that tag in the beginning. I believe that in the Bible it talks about prayer and meditation. So
meditated. Yeah, Jesus
yeah,
meditated, says
yeah.
meditate all the day and the night.
Right. And I think that's part of fasting and stuff like that. It's not a topic I'm really that I have a lot of awareness on, but I do believe that. And I think that when we meditate, we get to choose what we meditate on. And so, but I do think that, like me, there's some people out there, their knee-jerk reaction might be like, well, meditation and mindfulness isn't really a godly thing. And I beg to differ if you look at what it is and how it works. Now, if you're getting into meditation to do astral projection, that's a little bit different.
That's a
Not
whole nother
Right,
ball of
judging
wax.
those
We're not
who
going
do
there.
that. I'm just saying that would then become something that's not of God or the Bible. So,
we
but
should get a Ouija board.
yeah, no Ouija board, no crystals, things like that. Crystals are pretty, but they're not. Anyway, that's a whole other topic. I'm not going to go down that road, but I just want to address that because I know that
Yeah.
there are people out there like me who were like, might have that reaction of like, I don't know if that's okay to do. It is.
Yeah.
It is.
Yeah.
I feel pretty confident in that, knowing more about it now than I did then.
Ladies, thanks so much for doing this topic with me because it was so prevalent, of course, with the surgery and life. And I love how life presents itself and says, you need to dig into this one a little more, and so I really appreciate you ladies doing that with me and
No problem.
for going through this lovely adventure with me. So thanks a lot.
You're welcome. Happy to do it. All right. Well, just a friendly reminder that anything discussed in this podcast is not to be used as a diagnosis or a replacement for conversations with your own doctors, therapists, psychologists, or other medical professionals. This episode is on YouTube and most major podcast platforms. And if you're not a subscriber, we'd love for you to be one. So don't forget to like and click the subscribe button to keep up with our upcoming episodes. We're on Facebook, Twitter, and Instagram as Behind the Mask PC. You can also email feedback and future episode ideas to behindthemaskpc@gmail.com. Links to contact myself, EJ, Lori, and T will be in our description as well. And on behalf of the ladies and myself, thank you for listening, and we'll talk to you next time. Bye.
Bye.